So everybody has a bad night from time to time, right? Like if you're preparing for an exam, or we just got out of a relationship, or maybe even something positive happens, like, we're really excited for a new baby. Like all those things can impact our sleep, occasionally. And usually what happens for most people is that once the stressor reduces, they're done their exams, they've gone over their breakup, their sleep gets back to normal. That is a completely normal phenomenon. But for a subset of people, that's not exactly what happens. They start to notice that despite the fact that the stressor is kind of long gone, they're still having problems sleeping. And in this video, I'm going to talk about why that happens and how does acute short-term insomnia end up turning chronic and becoming insomnia disorder. Hi, my name is Dr. Parky. I'm a clinical psychologist and a behavioral sleep medicine specialist. I did my postdoctoral fellowship at Stanford's Sleep Health and Insomnia program, and I also happen to be the author of The Insomnia Paradox, which is a self-help book for cognitive behavioral therapy for insomnia. So, to answer the question of how acute insomnia turns chronic, we need to turn our minds to something called the 3P model, which was developed by Arthur Spielman as a model for understanding how does insomnia develop and then is maintained over time. And the 3Ps stand for predisposing, precipitating, and perpetuating factors. So to start, predisposing factors are the factors that make some people more likely to have insomnia or develop insomnia compared to other people. So some predisposing factors could be people who are worriers. So if you're somebody who tends to just worry a lot, of course, like that person is going to be a little bit easier to capture sleep disturbances as someone who's kind of more carefree and doesn't really mind when like a stressor arrives. Or it can actually even be things that are like, a noisy neighborhood. If you're constantly hearing the train blaring at night and that's always waking you up, unsurprisingly, that's going to be another predisposing factor, another vulnerability factor that makes it easier for you to have sleep disturbances compared to someone who lives at a place where it's usually quiet and it's dim. That person's probably going to have less trouble on a day-to-day when it comes to sleep problems. Now, the predisposing factors in and of itself is not enough to lead to insomnia. It kind of operates at the sort of baseline, and it can certainly interact with the second P, which is the precipitating factor, the thing that leads to you having an insomnia at the beginning, at least. So this could be preparing for an exam or a scary presentation. It could be a few nights that you had trouble sleeping because you were traveling to a different country in a different time zone. It can be basically anything, and you probably have a sense of what the thing was that led to the insomnia beginning in the first place. But for some people, it might just happen unexpectedly. I just had a poor night, and then I had a second poor night, and then all of a sudden it's been 10 years and now I have chronic insomnia. But usually there is a precipitating factor that led to the insomnia or your sleep problems going above the insomnia threshold. Now, I want to highlight precipitating factors leading to short-term insomnia. That is a completely normal thing. So when we're, preparing for an exam, we're going to be stressed, and stress is going to impact our sleep. Like that is completely normal. But for some people, what happens is that despite the fact that their stressor is now over, their sleep doesn't go back to normal. It doesn't go back to baseline. It actually continues to be maintained by the third P, which are these perpetuating factors, these different behaviors, as well as these different ways of thinking about our sleep that continue to maintain our insomnia and then becomes chronic insomnia slash insomnia disorder. And the way that we think about it in terms of treatment is that cognitive behavioral therapy, it doesn't worry so much about these predisposing factors. Like some people might be a little bit more worried. That's okay. And it certainly is not going to bother too much with precipitating factors because stress is a part of life, and poor sleep occurs for pretty much everybody. But what we can do is to target these behaviors as well as these ways of thinking about our sleep that maintain sleep problems. And to understand what might be some of these perpetuating factors that we target in CBT, you can kind of think about, how have you thought about sleep differently, or what changes in your sleep habit have occurred since you've struggled with insomnia. So these could be things like, well, I've become a lot more worried about my sleep. I'm always thinking, what if I don't sleep tonight? What if tomorrow is going to be terrible? I also try to like make up for my sleep. Like I try to sleep in when I can or go to bed early, or, I might try to take a nap whenever possible, or I try to push it away. You can see how our reactions to sleep have changed in the context of these perpetuating symptoms and perpetuating factors. So in subsequent videos, I'm going to talk more about, what are some of the evidence-based strategies that target these perpetuating factors and get us out of the insomnia trap and get us back on track. Otherwise, thanks for watching this video. I'll throw out a couple more videos if you're interested, and I'll see you in the next one. Bye-bye.